Good afternoon. I'm Sarah Hughes, Immunization Coordinator for Public Health, Madison Dane County. Getting sick with the flu is undesirable in any given year, but 2020 is not a typical year. We're concerned that the current pandemic overlapping with the upcoming flu season has the potential to cause a twindemic, which could result in severe illness and an overwhelmed healthcare system. There's no vaccine for COVID-19 yet, but there is a safe and effective vaccine to prevent the flu. I'm pleased to announce that today we've opened a free drive-through clinic here at the Alliant Energy Center. Free flu shots are available for Dane County adults and children 6 months and older who do not have insurance, and Dane County children 6 months and older who have Badger Care or Medicaid. Getting the flu makes you more susceptible to other illnesses like COVID-19, so if you're worried about that virus, you should be worried about the flu as well. We're especially concerned for those who are already disproportionately affected by COVID-19. Our goal is for everyone in Dane County to get a flu shot and to get it early, before the flu starts to circulate in our community. This is how we can prevent a twindemic. While flu shots are readily available through clinics and pharmacies, adding this free drive-through clinic for our community members who lack insurance coverage ensures equitable access to vaccines that will help protect them from getting sick or hospitalized with the flu. The drive-through flu clinic will be open Tuesdays and Thursdays from 12 p.m. to 8 p.m. and Wednesdays, Fridays, and Saturdays from 8 a.m. to 4 p.m. at the Alliant Energy Center. The clinic will be closed Sundays and Mondays. You can walk, bike, or drive to the site, and if you drive, you can stay right in your car to get your flu shot. You don't need to make an appointment, and you won't be asked for identification or about your immigration status. Interpretation and free transportation will also be available. Anyone younger than 18 years old must have a parent or legal guardian with them to consent to get the flu shot. We ask everyone to wait 15 minutes after getting their shot to watch for any possible side effects. The clinic will remain open until November 21st or until supplies of flu shots run out. Although the flu clinic is running out of the same space as our COVID testing site, you will not be able to get a flu shot and a COVID test on the same day. This is part of the CDC guidance put forth this year, which says that flu shots should be postponed for anyone who tests positive for COVID in the last 14 days, is waiting for a COVID test result, regardless of if they have symptoms, until they meet the criteria to discontinue isolation. We will also postpone flu shots for those experiencing potential COVID symptoms in order to protect the health of staff and those attending the flu clinic. While a flu shot is the best protection against getting the flu, there are other precautions you can take to stay healthy. Avoid close contact with people who are sick, and remain at least 6 feet distance from others. Stay home when you're sick, wear a mask when you're around others, avoid gatherings, wash your hands often, cover coughs and sneezes, avoid touching your face with unwashed hands, and clean and disinfect frequently. If these precautions sound familiar, they should. They're what we've been advising all along to help prevent the spread of COVID-19. They are evidence-based measures to prevent any illness from spreading, including the flu. Continuing those strong prevention measures and getting your flu shot as soon as possible will help keep you healthy. They will also help us avoid a double whammy of both COVID-19 and flu, causing widespread illness and strain on the ability of hospitals to provide care. Thank you. And I can take any questions if there's any as well.
What kind of supply do you have? How many doses do you have to give out this way?
We have about 6,000 doses to give out.
Given that flu activity was fairly low in the southern hemisphere this year, do you think it may be low in the northern hemisphere this winter because of that and because we're all wearing masks for some people? If the risk is low for flu, why should people still get a flu shot?
We know that the risk is still there, and so it's one of the easiest things that we can do to protect our health. And there's no guarantee of what our flu season will look like this year. And so we're really encouraging everyone to get their flu shot and also to continue those safety measures that we've all been taking, such as wearing a mask and social distancing, with the hopes that we can keep, we won't have a bad flu season like we have in previous years.
This is more of a, sorry, this is more of a COVID question, but does Public Health Madison Dane County have enough contact tracers to keep up with, the rising cases in Dane County?
Yes, we currently do have enough contact tracers available to keep up with the case numbers that we've been seeing.
Have you guys already been giving out flu shots today?
We have been, yep. So we started giving flu shots at noon today.
Then kind of demand or the numbers for today so far?
It started off slow so far. So there's definitely still availability. We want as many people to come out, and we really want to encourage people to come as early as possible too, to not wait until the end of the month or as we get further into the season. And so COVID testing has been very busy, but once you arrive at the Alliant Energy Center, you will be directed to a different line for a flu shot. And so you will not have to wait in the line for COVID testing if you are here for a flu vaccine.
Do you have any comments on the traffic outside with, took it so good to get in here?
Yeah, so today's the first day of our new schedule for both COVID testing and then adding in the flu vaccine. And so I think there'll be some adjustments. So we no longer are doing COVID testing on Mondays here at this site. And so I think there'll be some adjustment for community members of getting used to that. And then as we transition to this new schedule, hopefully wait times won't be as long.
Transition would be to kind of start reducing that wait time?
No, I think we are seeing rising case numbers as well across the state. And so I think a lot of people are looking for testing, and it's hard to say what that will look like this week and into the coming weeks. All right, thank you.